Halo saudara, apa kabar Anda hari ini? Semoga selalu dalam keadaan sehat. Saudara, diagnosis kanker payudara ini bisa menjadi momen yang menakutkan. Tetapi dengan perencanaan pengobatan yang tepat dan terstruktur dapat membantu pasien dan juga tim medis untuk menentukan strategi terbaik mulai dari pemilihan jenis terapi, operasi, kemoterapi, radioterapi hingga perawatan pasca pengobatan. Lantas bagaimana rencana perawatan yang baik untuk pasien kanker payudara serta seberapa besar peluang kesembuhan yang akan didapat? Kita akan bahas lengkapnya bersama saya Amanda Haj selama 30 menit ke depan di Bincang Kita. Dan hari ini saudara, saya kedatangan dua narasumber saya yang luar biasa spesial sekali ya. Yang pertama adalah Dr. Tang Xiao Wei, merupakan pakar bedah onkologi dari Solis Breast Care and Surgery Center, serta Dr. Peter Ang yang merupakan Senior Medical Oncologist at OncoCare. Hello, Doctor.
Hello.
How are you, Dr. Tang?
I'm good, thank you.
Okay, nice to meet you again here.
Nice to see you.
Okay, and Dr. Peter, how about you?
Yes, good.
Good.
Yeah, good to see you.
We are ready?
Yes, we are ready to go.
Yeah. Because today we are discussing about treatment plans and post-treatment plans for breast cancer patient.
Yes.
But first, let's talk about what step a patient and doctor should take if a patient is diagnosed with breast cancer. Maybe first, Dr. Tang?
So the first thing is don't panic.
Don't panic.
And don't worry. Okay, because they must remember that even though breast cancer sounds very scary, but there is actually very good treatment and it is very treatable, and there are actually many good treatment options for it. Most importantly, they should actually see a doctor, and the doctor will first then advise them and find out more about the type of the tumor and the different features about the tumor, and all this will help them determine what's best and what's the next appropriate step of treatment. Then depending on the subtype of the tumor, sometimes there are different receptors and different features and how aggressive the tumor is. That will help the doctors also decide. And also sometimes the doctors will organize further scans to evaluate the rest of the body. So other than just the tumor in the breast, sometimes we check other parts of the body. For example, the lymph node in the armpit area, or sometimes we do the full scan on the rest of the body to see if there's any spread. So depending on that, then the doctor will actually refer you to appropriate doctors or other specialists, and then to guide the next best treatment.
Okay, so the first that we have to do is to don't panic.
Yes.
Yes,
That's
okay.
the most important.
It's the most important. And now, Dr. Peter, what is the process for determining a breast cancer treatment plans for the breast cancer patient?
Yeah, so I think that the first step is that you need to know the enemy that you're dealing with, which is the cancer. And so this first process is called staging. And staging just means you want to know whether this cancer is early, whether it is small in size, has it gone further to the lymph nodes, or even further than that to other parts of the body.
Okay.
So the staging process would involve examination, and sometimes will involve scans, like ultrasounds or even PET scans to see the rest of the body and how it is affected.
Okay, okay. And how does it affect the surgery, doctor?
So then depending on the staging, so the lowest stage is usually stage 0. So stage 0 tells us the disease is actually very, very small and very early. And sometimes, most of the time, that we only need to do surgery in the breast area only. Yeah, and the cure rate is very, very good. But if stage 1, stage 2, stage 3, we may need to do surgery not only in the breast, but also the other areas around it. For example, the armpit lymph nodes.
Oh.
Yeah, so then that will help the doctor know whether is there also, how much is there any spread to the lymph nodes, and how much is the spread in the lymph node. Also, it depends on the size of the tumor and the size of the patient's breast. Because if the tumor is very big and the breast is very small, then it is a bit hard to save the breast. But sometimes if the patients still want to save the breast, or they want to have a shape of the breast, yes, we can remove the whole breast, and then we can use other parts of the body, for example, tummy, muscle, and then we can build a new breast for the patient. We need to assess the patient, see what the patient wants, see what the patient prefers in the shape and the size of her breast, and whether how much treatment she wants to undergo in terms of the types of surgery.
Okay, so what should patient consider before taking action, Dr. Tang?
So like I said, patient should think about what she wants. So before that actually, we need to think about the stage, like Dr. Peter mentioned, and the type of the cancer.
The type of the cancer.
Yeah, so and then with the stage and the type of the cancer, it gives us a good information about all the different types of the cancer. The doctor can then recommend a suitable treatment.
Okay.
And then if most of the time actually, they do surgery first. So if we do surgery first, then it depends to the patient whether she's important for her to have a breast, or if we're able to just take out the tumor, keep her normal breast, or if the tumor is very big and we need to remove the whole breast, then she needs to think whether she wants to undergo an extra procedure, and usually can be done at the same time. But if she wants to build a new breast for her and a new shape of the breast, and whether that's important for her. Yeah, and sometimes then depending on which option she chooses, she may or may not need radiotherapy after that.
Okay.
So it depends on a little bit what she wishes.
Okay.
And also importantly, it's good that patients have the trust in the doctor and in where she has her treatment, and she believes that the doctor is getting an accurate treatment and recommending the right treatment for her, and so that she can hopefully get the treatment as quick as possible. Yeah, to give her the best outcome.
Okay, as quick as possible. This is what I want to ask. So how soon can patient have surgery after getting the examination result?
So for us in Solis, we have our partner Luma. We have our own day surgery facility. So often from biopsy to get the results is a few days, so maybe 2 to 5 days. And then once you get the results, you can discuss the results with your doctor. So if, like I mentioned, a small surgery, so we just take out a little bit of the tumor and what we call the lumpectomy. Just we take out the lump and a bit of the lymph node. That is a very small surgery. Maybe about 2 to 3 hours. And often we can do the surgery maybe within a week or 2 weeks. Yeah, so that is very quick and it is a very short surgery, and patients usually can recover very quickly from it. Yeah. If the surgery is a bit bigger, like I mentioned, we remove the whole breast and we need to rebuild a new tissue back. So using tummy or something, then that sometimes, because it's a bigger surgery, needs a bit more planning and sometimes need other specialists like a plastic surgeon or reconstruction surgeon. Then it's bigger operation, maybe sometimes within about 2 weeks. Yeah, we can try and organize.
Wow, nice. Okay, thank you so much Dr. Teng and Dr. Peter. I have a lot of questions to ask, but we need to take a break before ya. Oke, jadi saudara jangan kemana-mana, tetaplah bersama kami di Bincang Kita. Kembali lagi bersama kami saudara di Bincang Kita, and we are still here with Dr. Teng and Dr. Peter, ya, masih membahas mengenai bagaimana rencana treatment dari kanker payudara dan juga post treatment untuk penderita kanker payudara, ya. Nah, Dr. Teng, does every patient with breast cancer receive the same cancer treatment plans?
Of course not, because we know that there's different types of cancer. So just now I mentioned, based on the biopsy, we can find out different features of the cancer. So usually using that, we can guide the treatment. And cancer treatment is actually what we call multimodality treatment. So often it includes surgery, chemotherapy, radiotherapy, anti-hormone treatment, and sometimes there's something called targeted therapy. And these different types of therapy is also given by what we call multidisciplinary. So many different doctors are involved in the treatment. And so for myself, I'm a surgeon. So for me, usually I plan the operation part. Yeah, so then from the operation or the surgery, it depends whether the patient wants to save their breast or not. And depends, like I mentioned just now, the size of the tumor to the size of the patient's breast. And then we can discuss whether the patient wants reconstruction or not. So that's different types of surgery. And also depends on the patient's wishes, because sometimes, most of the time actually, if we just take out just a little bit of the tissue, we need to treat the rest of the breast to stop the cancer coming back again. And that's also radiotherapy. Yeah, so if they have a small operation, lumpectomy only, then most of the time they need radiotherapy after that. So lots of things to consider in the different types of treatment.
I'm curious, actually, how many types of cancer
So there are 4 main types of cancer,
Okay,
and the cancer all depends on what we call the receptor status. The main 2 receptors are estrogen receptor, progesterone receptor, and HER2 receptor or CERB2. So the commonest one is something we call luminal A or hormone receptor positive. So it's a hormone receptor positive, ER, PR is positive, HER2 is negative.
Oh,
yeah.
okay.
And then there is another one called HER2 enriched, which is so the ER and PR can be positive or negative, but the HER2 is positive. Yeah. And then there's another one called triple negative. So all 3 are negative also. So
Okay.
yeah, so many different types of tumor.
Oh, okay. Then how, Dr. Peter, how do doctor determine whether a patient needs surgery, chemotherapy, or hormone therapy?
Yeah, so the 3 main types of breast cancer, they behave differently. And so nowadays we understand that you cannot just look at the tumor under the microscope and know that how it's going to behave. Traditionally, we look at tumors, we say, hey, you know, it's a big tumor, or the lymph node is involved, it's going to be aggressive. But nowadays, those that are generally hormone negative, they tends to be a bit more aggressive than, let's say, hormone positive breast cancer. So this testing on the tumor helps us to decide, is it something that is going to be aggressive? Now, generally speaking, the sequence for treatment for many patients will be surgery first, followed by chemotherapy or hormone therapy. But in those that are hormone negative, generally speaking, many of them will get chemotherapy first if it is a big tumor. And there are advantages of giving chemotherapy first. There is a 80 to 90% chance sometimes for it to shrink. And if somebody has a bigger tumor, it shrinks, it makes the surgery easier. And somebody who sometimes may have mastectomy can they end up having breast conservation, meaning they may not need a mastectomy after the chemotherapy.
Oh, okay.
So these choices are actually useful for patients, and it allows the patients to have many more choices and not to have a mastectomy. That means not every patient would need a mastectomy.
Okay,
Yeah.
okay. Does every breast cancer patient always need a surgery, Dr. Tang?
I would say nearly yes.
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 Oh.
Yeah, because no matter, even though if we, for example, Dr. Ang said that we can shrink the tumor, but we can never be certain, even though you cannot feel the tumor, but we can never be certain that all the cells have died off. Because each cancer cell is so small. So until we are able to take that tissue out and check it under the microscope, we can then be certain, is there still cancer or not?
Oh.
Yeah. So we would always want to try and remove the disease or remove the tissue to be tested.
Okay,
Yeah.
okay. Now, Dr. Tang, Luma offers day surgery with an on-site frozen section facility, right?
Yeah.
So, which is claimed to be able to increase the effectiveness of treatment.
Yeah.
Could you please explain about this?
Okay, so actually, it doesn't change the treatment, but the day surgery facility allows us to actually perform many surgeries in a simple setting. And in our day surgery, we can actually organize the cases fairly quickly. We do choose patients who don't need to stay in hospital because we know that for simple surgery, if patient can go home and recover, then they actually do better and they are in their familiar surrounding and they can then recover back to their normal function better. So we choose patients based on whether they are fit. Hopefully, if they don't have many other health problems, the type of simple surgery also can be quite quick. And after that, when the patients go home, we can give them medicines to control their pain, for example, if they are painful, and we can advise on appropriate dressings.
Okay.
Also, at our day surgery facility, we also have something called on-table frozen section. So we have a pathologist who is a specialist in breast, where she can actually then check the tissues that we have taken out to ensure we have taken out the correct tissue and make sure that the edges are clear and also check the lymph nodes to make sure that is there any cancer that has spread or not. And with this, we can actually make sure our surgery is accurate. We can try and minimize and we just do everything at one stop so that hopefully patients don't need to come back and redo another operation second time, third time. So all this helps to ensure that it is accurate. And the day surgery also is a short facility where patients after that can recover and hopefully they go home quicker. so that they are back in their own home, comfortable surrounding with all their family around them to support them. But we make sure that we choose patients who are suitable and patients who are healthy. And we know that these patients actually will do better in the long run.
Okay,
Yeah.
now we talk about the side effects of cancer treatment,
Yes.
Dr. Peter. So, what are the possible side effects of different breast cancer treatment, and how can we manage the side effects?
Okay, so I think that firstly, I want to say that many patients may not need chemotherapy, which most people are concerned about. Actually, 60 to 70% of breast cancer are hormone positive, meaning they will need an anti-cancer hormone treatment, which is actually a tablet that is taken daily for a few years, and it doesn't lose hair, no vomiting. Okay, but there are some medicine side effects when you lower the hormone. Some women can have hot flushes, maybe some dryness, some minor mood changes, and so on.
Moody.
Not always, not always.
Not always, okay.
Yeah, but having said that, of course, chemotherapy definitely will have stronger side effects for a short period of time for patients who need it. And in fact, what we perceive as more difficult to manage, things like hair loss, okay?
Hair loss,
yes.
yeah.
I think it is a big concern for many patients.
Especially women, right?
Men too.
Oh, men too, okay.
But there are some ways to reduce hair loss. It's called scalp cooling. That means during the treatment, there's a cold cap that we give to reduce the hair loss. But unfortunately, it is still not perfect. There will still be some hair loss for many patients. Other than that, things like fatigue, nausea, they can be managed. Okay, there are some very good medicines that we have now. We don't expect patients to be vomiting very much. Maybe the not so common side effects like hypersensitivity or like an allergy, rashes, fever, they are really not common and they can be managed. Almost all our chemotherapy is given outpatient, meaning many patients don't really need to stay in the hospital. And that, I think, is also an encouragement for a lot of patients, just like the surgery and all that. It simplifies a lot of things for patients. And I think patients are beginning to accept that it's a difficult time in their lives having a cancer diagnosis, but it's something that they can overcome.
Yeah. Hopefully.
Yes.
Yes, sure. Okay. Well, the discussion is getting more interesting, Dr. Peter and Dr. Tang, but we will continue right after this break, ya? Okay?
Okay.
Jadi saudara, jangan kemana-mana, tetaplah bersama kami di Bincang Kita. Kembali lagi di Bincang Kita, saudara, dan saat ini kita masih melanjutkan obrolan mengenai rencana pengobatan yang tepat menuju langkah kesembuhan bagi penderita kanker payudara. Masih bersama dengan Dr. Tang dan juga Dr. Peter di sini. This question is for you, Doctor. Have there been any recent advancement in surgical techniques nowadays?
Yeah, so there is a very new term that we call for breast surgery or breast cancer surgery called oncoplastic surgery.
Oncoplastic surgery.
Yeah, so onco is the cancer part, so oncology part. Plastic is the plastic surgery techniques. So we use these techniques to be able to remove the cancer, but also keep the patient having a good outcome, a good shape of the breast, and maintain her size of the breast. So some of these techniques are newer, and so just now I mentioned whether if it's only a small lump, we can save the breast. But actually with these new techniques, sometimes even a bigger tumor, we can actually remove it and save the patient's breast. But what we can do is then we either sometimes reshape the breast with different techniques, or we use tissue from nearby. So just near the armpit, the side, or at the chest, to reshape and push it in so that we can create the shape and give the patient a good shape and size to match the other side. The other technique also is if we can't do that, then one side is a bit smaller, then sometimes what we do is we reshape the other side of the breast, so make it smaller to match. So give the patient a good match. So as long as they match, hopefully the patient is satisfied. Yeah, and there's also new techniques like keyhole surgery or what we call minimally invasive surgery.
What is that?
Minimally invasive or keyhole.
Okay.
So we use small scars. So then the scars can be hidden either in the armpit or sometimes at the bottom of the breast. So the scars cannot be seen. So then we can use these techniques usually for patients who may need a mastectomy. So they remove the whole breast but with a small scar. Then so after they do the reconstruction, if the scar is hidden, either under the breast, then maybe even when the patient showers, she doesn't see the shape, she doesn't see a big difference in the shape, she doesn't see a big difference in the size, or she cannot see the scar. So hopefully, then she feels better about herself. So all these techniques are actually very good because they help patients to maintain a good body image and maintain their quality of life after the surgery. Because now we are actually getting better and better at treating breast cancer. So we actually have a lot of women who live very long after their breast cancer treatment, and they become long-term, what we call long-term survivors of breast cancer. So it's important that we give them a good body image and a good quality of life with it. And some of these new techniques actually helps us. Yeah, so we give them a good shape, a good size. And sometimes when they're walking around you, you don't even know that they've had cancer surgery or they've been treated for breast cancer.
Oh,
Yeah.
I see. Okay, okay. And how about you, Dr. Peter? How do you see the development of cancer treatment nowadays?
Yeah, so I think to echo what Dr. Tang has said, is that actually to help the women to feel it's normal as fast as possible, and that this whole journey is just a small interruption in their lives.
Okay.
And so in order to do that, some of the newer medicines, and today I'll just talk about targeted therapy, for example. So there are a whole group of medication targeted at HER2 or HER2 tumors. Now, we said earlier that trying to know which exact type is important because the response when we give chemotherapy with HER2 therapy is very high. So a woman with a breast lump is 80 to 90%, it will shrink by half, and about 50% it may disappear at operation. So imagine that if somebody has a 2 to 3 centimeter tumor, if it's given chemotherapy and HER2 therapy first, and at operation there's hardly any tumor left, the surgery and a lot of the treatment that is done after that is so much smaller, and they will feel that it is much more normal and to go back to their lives again.
Okay.
So that whole process does help a lot of women to manage the whole process of cancer itself.
Okay. Could you please explain about the advance of cancer treatment nowadays? For example, like, the therapies for, how many therapies for breast cancer patient?
Yeah.
So
I think that if we look back at history, chemotherapy was given for a whole year. But we don't kind of do that now. So most chemotherapy regimens are about 3 to 6 months. And of course, if they are very smaller tumor and all that, I think firstly, we try to avoid chemotherapy. It's got a bad name. But there are some people who still need it for higher risk tumors. And usually it's about 3 to 6 months of the chemotherapy. But having said that, they may need hormone therapy, targeted therapy, or sometimes immunotherapy as well. And these are additional treatment, and sometimes they may need a little bit longer time, but it doesn't affect things like hair or doesn't make them too tired. So these are all good advances.
Okay. My last question for both of you, Dr. Tang and Dr. Peter, the message. I want to ask about the message. What message do you want to share to women, especially for the breast cancer patient?
Yeah, so I think I started with it. So the first thing is don't panic.
Don't panic.
And don't worry too much, okay? Because we actually now have very many good treatment options, and actually many patients recover and they actually return back to their normal self. So yes, like Dr. Peter says, it is a little short period of discomfort or sometimes difficulty during the treatment, but most patients recover back to their day-to-day normal life after that. So just must keep that in mind and to stay strong and then take it one step at a time. So each time a little bit of treatment, one step at a time. Don't delay your treatment. Don't delay your diagnosis. Don't worry and try.
Don't be afraid.
And try alternative or not recommended. Don't run away. So listen to your doctor. And find a doctor that you can trust. And then hopefully then take it one step at a time, each little bit of treatment. And hopefully after maybe 6 months, 1 year, you're back to normal. And you're back to where you are.
And Dr. Peter?
I think at the end of the day, accurate diagnosis and knowing exactly what we are dealing with is actually quite important. And nowadays with internet, Instagram, and so on, social media, I think that there's a lot of information out there. A lot of patients with breast cancer diagnosis, they are very confused. They try to read a lot, and then they have got a lot of good friends and relatives giving them information. But I think in that confusion state and trying to find accurate and right information is important. And what we just shared actually is these are based on studies and trials done by many women with cancer before who have undergone trials. So this information that sometimes we share, it is not information that is just plucked out of the air, and people, it is useful as a reference. That means many people have walked this way before, providing this experience and information.
Okay.
So they're trying to know which tumor type, whether they need hormone therapy, targeted therapy, or some of the newer, or maybe it's just a simple standard treatment, or maybe they don't even need any chemotherapy at all, is important.
Okay.
And it starts with getting the right information. That means efficient biopsy, getting the information out, accurate reading, a doctor to explain it to you. And I think these are all important steps in the journey.
Yeah, I do agree. Thank you so much once again, Dr. Tang and Dr. Peter. Today was fascinating, but the time is up. Thank you so much for coming ya. Oke saudara, pastikan Anda, semoga obrolan tadi ini bermanfaat untuk Anda karena tidak terasa sudah 30 menit kebersamaan ini. Jadi pastikan ya ketika sudah terdiagnosa kanker payudara, yang pertama harus dilakukan jangan sampai panik dan segera untuk melakukan pengobatan di tempat yang tepat dengan orang yang tepat. Ya, saya Mada Haj pamit undur diri. Terima kasih dan sampai jumpa.